Next. It's an extra. All right. Next, we have an item for our state legislative agenda regarding medicinal marijuana. Ms. Bergman.
Madam Chair, members of the committee, my name is Sasha Bergman from the City IGR Department. The matter before you is an amendment to the state legislative agenda that would add support for legislation at the Capitol to legalize the medical use of marijuana for patients with a debilitating medical condition. Just to provide brief context, 20 states across the country have legalized medical marijuana, as well as the District of Columbia, due to the remedy that it provides for folks with debilitating medical condition. And currently the legislature, as you know, came back into session on Tuesday. There are a couple of bills that have been introduced on this issue. The conversation is still ongoing, but this would just provide general support for the concept. And with that, I'll stand for any questions.
Thank you very much. I think we're going to have at least a couple of comments, if not questions. Councilmember Andrew Johnson.
Great. Thank you, Madam Chair. And I would like to move forward that we support this particular legislative agenda item. You know, medical marijuana is a valuable tool for doctors within our city throughout our state to treat symptoms. And I know that personally because I have glaucoma, an extreme version of glaucoma, and I've actually been through 3 different eye surgeries now. And it's amazing going through that process because I was on every single drug possible that was legal to treat my pressure and keep it down before going into surgery. And the importance of that is it buys time and actually reduces lost vision, and it also leads to better outcomes for the surgery itself. And my doctor actually split her time between Minneapolis and Florida. And in Florida, she was able to prescribe medical marijuana to patients. And she told me flat out, this improves the outcome for our patients who are in a situation like yours. And so I didn't have that option, though, in this state. And I don't want to see any of our residents or anyone else in the state lose vision that can be avoided by having all those options, all those drugs available. And with all of our residents in this city and with all of the different hospitals, all the different doctors, it's important that we stand up and advocate for them. So I'm excited to see this as a potential part of our legislative agenda. And I'd also like to say thank you very much to my doctor, Dr. Elena Grajewski, who is one of the top glaucoma surgeons in the entire region and country and works out of the U of M and has even done glaucoma surgeries on newborns as recent as just 1 day old. So just she's incredible and an asset to our state, and I look forward to providing one more tool for her in the fight against just a terrible disease. Thank you.
Okay. Thank you so much for that, Councilmember Johnson. And I know Councilmember Bender has joined our committee, and my understanding is she also would like to make some comment. Councilmember Bender.
Thank you, Madam Chair. I don't serve on this committee, but I came here today to share my story as well and to urge support of adding support for medical marijuana to our state's legislative agenda. I'm a cancer survivor. And in the few years since my diagnosis with breast cancer, I've gotten to know hundreds of survivors here in Minnesota and across the country. And this is a big deal. My course of treatment was similar to a lot of cancer patients. And, you know, 1 in 2 men and 1 in 3 women will experience cancer in their lifetime. This touches a lot of people's lives. I had surgery followed by 6 months of chemotherapy, a month of daily radiation, and years of additional drugs to prevent recurrence. And this is a common course of treatment for cancer patients. And each of these treatments have side effects. They cause nausea and pain and difficulty sleeping. And the drugs that are available today are narcotic pain medication, anti-anxiety pills, sleeping pills. And I don't see any reason that policymakers should stand in the way of a medical doctor adding medical marijuana to that toolkit to address the side effects of cancer treatment drugs. And so I'd urge everyone today to support adding this to our legislative agenda, and I really hope that our legislature and our governor will support legalization of medical marijuana. I think it is the smart thing to do and the compassionate thing to do for many people who are suffering today.
Thank you so much for joining us, Councilmember Bender. And my understanding is Senator Scott Dibble, who represents Minneapolis, is the chief author in the Senate. Is that correct? Maybe you can help me.
That is correct. In the Senate, there are 5 authors, including Senator Dibble, who's the chief author. It's bipartisan. In the House, there's Representative Carly Moline from Hibbing is the chief author, and there are 35 authors, including her, on that bill, also bipartisan. And there, I think there's also at least one other bill that's out there, and there may be others, but those are the 2. They're companions of each other, and those are kind of the big topic of conversation at this point. So.
Okay, thank you. Well, Councilmember Andrew Johnson has moved approval of this item, and I will ask if there is any further discussion. Seeing none, all in approval, please say aye. Aye. Opposed, and that item is approved. Thank you very much.